Have you ever wondered if you've been exposed to Lyme disease and the tests come back negative, or maybe you've had strange symptoms like fatigue, joint pain, brain fog, and someone told me, you're fine, it's not Lyme. But here's the truth. Lyme disease testing is complicated and the stakes are high because if you miss it or you misunderstand it, you may go years without a correct diagnosis. I'm Dr. Jason West. In this video, I'm going to help you understand how Lyme testing really works, the types of tests that are available, what your results actually mean, and when you should be attested. Now, I've seen thousands of Lyme patients who were misdiagnosed, misunderstood, and told their illness was all in their head. But when we dig deeper and when we test properly, we find the truth. So let's make sure you get the truth too. And stick around to the end. I'll answer some of the most frequently asked questions about Lyme testing that could save you time, money, stress, and accelerate your healing because it's 25 years of working with people just like you. Now, Lyme disease, an infection caused by a spiral-shaped bacteria called Borrelia burgdorferi, and it's transmitted through the bite of an infected tick, and most often the black-legged deer tick. Now, there's another discussion that we're going to have about in vitro, passing on to kids, and is there sexual transmission? And just to give you guys some heads up, look, Lyme disease is a spirochete, and syphilis is a spirochete. They're cousins. Now, if syphilis can be sexually transmitted, I can't help but think that Lyme can be sexually transmitted. But listen, that's not the accepted medical norm. That's just my personal opinion. Now, getting back to Lyme, it's the most common in wooded, grassy areas. But ticks don't respect like state lines, immigration, border control, and you can get bitten and never see the tick or the bite. There's some research that shows that up to 60% of people that have Lyme disease don't ever remember being bit. Now, once inside the body, the bacteria can cause inflammation of the joints, the brain, the nerves, the heart, and more. And symptoms can mimic other diseases like rheumatoid arthritis. Fibromyalgia is a common culprit, chronic fatigue, even multiple sclerosis, and the British Journal of Medical Practitioners states that chronic viral infections, chronic bacterial infections, and they specifically name Lyme, can cause neurobehavioral, so your nerves don't work right, neurodegenerative, they break down, autoimmune, or like fake autoimmune conditions, fatiguing illness, and even mess up your psychiatric, your stress, your depression, your melancholy. That's what makes the testing so important. And it's so frustrating when it's done incorrectly. And that's one of the things, of reasons of the video, is I wanted to share with you what I've learned. Now, before we get into the specialty labs, look, a good place to start is by doing some normal routine labs and just checking function. Now, the reason why I want you to do that is because the way to help people with autoimmune conditions, with chronic Lyme, chronic Epstein-Barr, ankylosing spondylitis, Sjogren's disease, and some of these other things, is to balance the body and treat the cells. So these standard routine blood tests can give you enormous information and really help you. So the complete blood cell count, your CBC. This test gives an overview of how your immune system is behaving. Are your white blood cells elevated? Like, are you fighting an infection? Or are they low or normal, even when you feel terrible? Now, this is really important, and a lot of doctors miss this. If you have a low white blood cell count and you have an elevated ratio, which is your neutrophils or your lymphocyte count, that tells us that the immune system may be ignoring or think it's used to having an infection. Now, go with me on this. The body can actually keep score or have a memory. Look, I have ropers and cowboys and people that have accidents and had a lost finger. Like, I have a roper that comes in, that's out roping, gets a rope caught around their finger. The cow takes off and pulls their finger off, and they'll come into the office and they'll say, Dr. West, my finger is killing me.
Ah! My finger.
Because that nerve that's been injured is telling the brain, I hurt, I hurt, I hurt. Now, Lyme disease people often don't have any amputations, but their nervous system is telling them they're sick, they're sick, they're sick. And so looking at some of these markers, you know, your immune system might be ignoring the infection because of that memory. By the way, there's a wonderful treatment that originated in Germany called neural therapy that is a really important thing for you to know about it because it helps to reset the nerves. Now, when your immune system isn't working, this is what I call a non-responsive immune profile. And it's a lot more common than people think, especially with chronic infections, Lyme being one of those. Now, after the complete blood cell count, we're looking at Again, the neutrophil count, these are the frontline soldiers of your immune system, and they are fighting bacteria. Now, if the neutrophils are off, either too low or oddly high, it can be a clue that your body is reacting to the infection. Maybe it just doesn't have enough horsepower to get rid of it. And another common test, a complete blood cell count, is really nice to check your liver enzymes, your kidney filtration, your trace minerals, your pH, your blood sugar. We want to balance all of those, and it's really useful. Does it tell you that you have Lyme disease? It doesn't. Does it help you to be healthy? It does. It helps to see the big picture and whether your immune system is stuck, sluggish, or swinging too hard. Now, there are two main tests most people hear about, the ELISA and the Western blot. So let's break them down. The ELISA test is called the enzyme-linked immunosorbent assay, and this is a standard screening test. It looks for antibodies. Those are the things that your immune system, it's responsive to Lyme bacteria. Now, if it's negative, most doctors stop. But that's the problem. Early on in the infection, your body might have made enough antibodies yet. So this test can be missed diagnosis, especially in the first month or month and a half after exposure. And there's another test called Western blot test. If your ELISA test is positive or borderline, the next step is usually the Western blot test. Now, this is more specific. It looks for antibodies against several Borrelia proteins, and think of it kind of like a fingerprint of the bacteria. And there are two parts of this. There's what's called the IgM, which is early infection, and the IgG, which is the late or ongoing infection. And you want to see a pattern, not just one or two markers. You'd like to see at least 5. Now, here's where it gets tricky. Many people in the chronic stages have a weak or confused immune system, so the test might be inconclusive or flat out wrong. And it doesn't test for all the species of Borrelia, which means you could be infected, but the test misses it. Now, there's some specialty labs at the West Clinic that we often use in advanced testing. And these are tests like the IGeneX or even the Armin labs or DNA. Now, these labs offer more comprehensive panels, including the co-infections, which are the hitchhikers to the Lyme like Bartonella, Babesia, or Ehrlichia, which are often why people stay sick. Now, I want you to take even a step further, because if you've been struggling with Lyme symptoms and maybe your ELISA test and your Western blot test come back negative, it's not because you don't have an infection. It's because those tests are limited by design. You see, traditional Lyme testing like ELISA and Western blot is only looking for antibodies against the spirochete form of Borrelia. That means that these tests are really only checking for about 20% of the disease process. And that's a big problem because Lyme just doesn't exist in one form, in my opinion. Now, this goes against the traditional or allopathic norm because I think that this Lyme is so clever and creative that there's different phases. Now, we're going to get into that in a minute, but one of the traditional tests that we can do long distance, or one of the advanced tests, is the IGeneX test, which is one of the most advanced lab options available. Here's what I like about the IGeneX test. It tests for multiple Borrelia species, not just the standard Burgdorferi, but it includes the IgM and the IgG antibodies to evaluate both early and late infections. And I like it because it can detect co-infections like Bartonella, Babesia, or Ehrlichia. And it can offer PCR and T-cell activation panels, which give you a better chance of catching the stealth infections that antibodies missed. Now, it's CLIA certified, which means it's a high regulatory standards. But if you ask me what the best test is for Lyme disease and the most promising, and that's the one that we're changing how we understand Lyme disease at its core, it's something you've probably never heard of. This is called medical microscopy. Now, this is a research project that we're involved in, and let's be clear, this is not recognized by allopathic or the FDA yet, but in my professional opinion, it's one of the most powerful tools that we have to see Lyme in real time. And here's why. The medical microscopy allows us to visually observe the life cycle phases of Lyme, and we see it in a drop of blood. Now, wait a minute. I keep talking about life cycles. And yes, most people, including the vast majority of doctors, don't think or realize or even consider that Lyme can hide in different phases. I believe that there's a spirochete phase. That's the corkscrew form that burrows into the tissues. There's an intracellular phase, and I feel that that's when Lyme goes inside of the cells. There's a spore phase where it literally kind of hunkers down and just wait for you to get tired or have some stress, and then it's pop up and you have a flare up. There's a biofilm phase and a budding phase. I want to talk a little bit about this budding phase because this is when it replicates and spreads. In traditional testing, only looks for one of the 5 phases, the spirochete form. So if you're in a different phase, the test misses it. And this is why the medical microscopy research is so important. It allows us to see the behavior. Now, this isn't a new thing. This goes back hundreds of years to a battle between Louis Pasteur, who came up with pasteurization and said it's the bug disease, an amazing medical doctor named Antoine Beauchamp that said it's the terrain. The terrain is what determines the sickness. Now, why this is so important is because when you just try to kill the bug, I feel that you're just making it easier for that to come back. You have to change the terrain, which doesn't seem like that big a deal, but trust me, when it comes to helping people to beat and conquer their disease, you got to make the cells healthy, the organ tissues healthy. And then what happens is it makes it so the environment doesn't allow the disease to come back. And that's what I've seen over the last 25 years. In medical microscopy, that research project, it gives us a better way to rule in and rule out Lyme, especially with those chronic complex cases where nothing seems to fit. And look, it's just not the microscopy. It's the patient history. It's the complete blood cell count. It's the metabolic panel. It may be the ELISA or the Western blot or the IGeneX test. And also it's looking at barriers to healing. Is it something that is blocking? Is it hormone imbalance? Is it toxicity? Is it environmental herbicides, pesticides? Look, that's what you have to do to get a full picture, because when you start helping cells to be healthy, that's when we see the best and the most reasonable and most enjoyable outcomes. Now, this is a question I get asked all the time. Dr. West, I may have had a tick exposure. We went camping in a tick area. I didn't see anything. I haven't feeling good, or my systems aren't making sense. Should you get tested? Now, if you've had a tick bite or an outdoor exposure in a high-risk area and you have symptoms of fatigue, joint pain, nerve issues, mood swings, or brain fog, or if you've been diagnosed with an autoimmune condition but the treatments aren't working, and maybe it's that mysterious illness that no one can figure out. Early testing is helpful, but don't rule out that Lyme patients just because the bite happened months or even years ago. Now, Lyme can go dormant and reactivate when your immune system is stressed. And so understanding your blood tests and understanding the other testing is so important. What does a positive, a negative, or inconclusive test actually mean? So if you go in and you get a Western blot, an ELISA test, IGeneX test, look, the most important thing is to coordinate that with your symptoms, but also to know if you've been exposed with Borrelia. That doesn't always mean that you're actively sick, but if symptoms are present, like that's when you need to consider treatments, and it's not just antibiotics. That may be part of it, but there may be other advanced things that we can do. Now, sometimes people get tested with some of those tests and it's negative, but that doesn't always mean you're in the clear. Like there's such thing as testing as false positives, and you could have a false negative due to a weak antibody response. A negative test doesn't always mean you're in the clear, because you could have a false negative due to a weak antibody response, the timing of the test, or even a non-standard strain of Lyme. And then what's frustrating is inconclusive tests that are actually pretty common. This means your immune system is reacting somewhat, but not enough to hit all of the standard thresholds. And in these cases, clinical evaluation matters most. Symptoms, history, co-infection, and responses to treatments are the keys. This is why I always say, don't treat the test, treat the patient. So there you have it. Lyme disease testing isn't always black and white. It's a complex puzzle, and if you don't have the right pieces, you can miss the big picture. That's why we combine advanced testing, clinical experience, and research, medical microscopy, to help get real answers and real healing. Now, if you're looking for more help, you can download our free Lyme recovery guide at www.lymefighter.com. And if you're ready to jump and go faster, you can talk to a real human about your symptoms. You should call the clinic, 208-232-3216, and ask for our Lyme disease patient coordinator, Jody. She's amazing. And hey, if this video helped you, give it a like, subscribe to the channel, and share with someone who's still looking for answers, because you're not your diagnosis and you don't have to do this alone. For some, this will help you even more. These frequently asked questions that come from 25 years of experience in helping thousands of patients. So question number 1, if traditional Lyme tests are only 20% accurate, why are they still being used? Well, traditional tests like ELISA and Western blot are still used because they're part of the CDC's 2-tiered testing protocol, and some of them may be covered by insurance. But just because the standard standard doesn't mean they're the most effective, especially in chronic complex cases. You see, these tests mainly look for antibodies to the spirochete form, which is just one of the life forms of the bacteria. And that's why I think it's so important to do the whole picture and whole evaluation. Question 2, Dr. West, if you had to pick a test that you do inside the laboratory, what would you do? Well, I'd pick the IGeneX test because it's more comprehensive. I mean, it looks at multiple Borrelia species. It detects both early and late stages, the immune responses like IgM and IgG, and includes the co-infection panels because Lyme often doesn't travel alone. It likes to go with friends or maybe even cousins. Now, it also offers PCR and T-cell tests that don't rely on the antibody levels, which is a huge for people with suppressed immune systems or confused immune system systems. Now, question 3. Dr. West, you mentioned medical microscopy. What is that, and is it really legit? Now, microscopy has been around for over 500 years, and it's a way we observe basically a specimen under a specialized microscope, allowing us to see the behavior of the organisms in real time. Now, in our medical research, our Lyme research, it helps to identify some of the phases of Lyme, which labs often miss. And again, it's not a standalone. It helps us to get a viewpoint, and it's still in the research phase. It's not yet FDA approved, and this is my opinion. It's one of the most exciting tools for Lyme diagnosis because it's a powerful layer of insight when combined with other clinical findings. Question 4, can I have Lyme disease if I never saw a tick or had the bullseye rash? Of course you can. In fact, studies show that a significant percentage of Lyme patients never recall a tick bite, and only a small percentage really develop the classic bullseye rash. Ticks can be the size of a poppy seed, and the bacteria can enter your system long before you even notice. That's why if you've been in a tick area or been around people that have had ticks on them, maybe the tick has come off, got to you, and disappeared, and this may be the explanation of fatigue, joint pain, neurologic symptoms, or a history of outdoor exposure. It's clearly worth investigating. Dr. West, can I do an IGeneX test or a microscopy test if I don't live near you? Well, yes, we work with patients all across the country. IGeneX kits can be shipped to your home, and we can help coordinate local blood draws for the complete blood cell count, the metabolic panel, and if we need to do hormone testing, if we need to do heavy metal testing and look at environmental impact of herbicides, pesticides, so much of that we can coordinate from a distance. But we're working on ways to access the research of the medical microscopy. But either way, I feel that we can do a lot to help you. What's the first step if I want to get tested properly? Well, the best way to start is by downloading our free Lyme recovery guide at lymefighter.com, and you'll learn how to identify key symptoms, understand your test options, and create a pathway forward. And again, if you want to jump forward and talk to someone that's had hundreds of patients experience, call our office and talk to Jody, our patient coordinator, and she'll walk you through your options and help you take the next step. Dr. West, if my test is negative, but I still have symptoms, what should I do? Now, this happens frequently, and it's not the end of the road. Tests aren't perfect, and many people with Lyme don't show up positive on paper. That's why I always say we treat people, not lab results. If your story, your symptoms, your immune markers point towards Lyme, we build a treatment plan to help the cells to heal. Everything we want to put in balance: biochemistry, biomechanics, hormones, help with emotions as much as possible. Look at all of your metabolic markers, your hormone markers, your blood cell markers. You don't need a perfect score to deserve help. And if you still have questions, drop them in the comments. I read those. And don't forget to like, subscribe, and share with someone else who's searching for answers, because you can be Lyme and we're to help you do it. Now, if you're looking for additional resources, you should check out this video. It's Lyme and the autoimmune system link that's right here.